Hello friends, hope you're well. In this video, I'm going to talk about how this new big, beautiful bill that just passed, I think the House and the Senate, how that impacts your home care business and the home healthcare industry in general. I didn't have time to go through the bill myself. What I love about YouTube is that there's so many niche channels now here on YouTube that you can find almost anything that you want. It's incredible. There's no excuse anymore, guys, to say you don't have enough information to start running your home care business. Because the information is not the problem. The problem is you're not taking the action. Because there's tons of information, so much. So since I didn't have time to go through the bill myself, I came across this YouTube channel and he says he read the entire 900 pages. I think he used AI to read it and summarize everything. So let's get into it. We're just gonna react to this video and I'll just give my insights of what this means.
This is the big, beautiful bill. It's over 900 pages long, and it's about to change everything from your taxes to your student loans to Medicaid. Most people will never read it, so I did. And in this video, I'm breaking down the wildest, weirdest, and most important parts, so you actually know what's coming. Some of it might help you. Some of it might hit you where it hurts. Let's find out what's really inside. This section of the bill covers Medicaid reforms under Title VII. Subtitle B, Chapter 1. It's focused on how states determine eligibility, how they handle enrollment, and how they manage costs. There's a clear shift here toward reducing federal spending by cracking down on what lawmakers are calling waste, duplication, and fraud.
See, I've already mentioned this in my previous videos before this bill came out. Like months ago, I did a video about how Medicaid and Medicare are not the best approach for you to get paid when you're running a home care business. And now this bill it's showing you guys why I said those things. So it's just confirming what I already talked about, that this new administration is not playing games. They're looking to cut everything.
But what that actually means is a much more rigorous process for people applying for or staying on Medicaid. If you've ever had to recertify your benefits or help a family member navigate Medicaid forms, this part might feel especially familiar and maybe a little frustrating.
I've never had somebody close to me, go through the challenges of being enrolled in Medicare or Medicaid, so I don't know what that frustration is like. But if you guys do know somebody that is close to you, that has been through the nightmares of getting enrolled in the Medicaid system or the Medicare system, comment below, because I'd love to know, so we can all know. If you thought it was a headache then, it's about to get 10 times worse.
So here's where it starts. The bill freezes two major Medicaid rules that would have expanded access to people in low-income or elderly groups. One was meant to improve enrollment in Medicare savings programs. The other focused on making it easier to qualify for Medicaid, CHIP, and the basic health program. Both are now on hold under this new law, blocked by a moratorium. And that's just the start. States are now required to reduce duplicate enrollment between Medicaid and CHIP. In theory, that sounds efficient, but in practice, it could mean more red tape for families who have children covered under CHIP and adults on Medicaid.
It's gonna be brutal. What happens when the economy starts to be volatile like it is now? And right now it's really collapsing. People get dislodged from their lives, their normal lives. Already people are quite chaotic. People are not organized like that. Most people are completely disorganized. So they're gonna put so much red tape that you have to jump all these hurdles in order to get these benefits. And since most people are not organized, some are going homeless, they're gonna say you need to provide a physical address, show us proof of physical address. How are you gonna show proof of physical address when you've been evicted? Because you lost your job. It's gonna be a nightmare, guys. The puppet masters know what they're doing, guys. Trust me. A lot of people are about to lose benefits because of this.
If systems don't talk to each other well, which many don't, families could lose coverage for reasons that have nothing to do with income or need. They're also targeting people who have passed away but are still marked as enrolled in the system. States now have to regularly check for and remove deceased individuals from Medicaid rolls. Same goes for deceased providers. Doctors or clinics, they're still showing up as billable even after they're gone. Again, this is being presented as a cost-saving measure, but it requires new systems, new software, and more oversight, which many states are already struggling to keep up with. And then we get to payment reductions. If states are making excess payments, meaning they're paying more than they should be for certain services or beneficiaries, the federal government is going to reduce the money it sends them. It's a way of saying, clean up your books or we'll send you less. Another big change is how often eligibility redeterminations happen.
Okay, so you heard that. They're going to put caps. So let's say in the state of Ohio, they're only paying Medicaid $28 an hour. It's going to remain like that for the next 5, maybe 8 years. I'm laughing because I know exactly what's happening. They're going to keep it at $20 payouts. But meanwhile, in about 3 years, the cost of eggs and bread is going to be $28. I've seen this before. If you are still playing this game, I feel bad for you. You better go homeless. I'm not kidding you guys. A lot of you people that are hooked on this, I call it Medicare, Medicaid crack. You're going to struggle, guys. You've not seen anything yet.
Basically, states now have to recheck whether someone still qualifies for Medicaid more frequently. So if your income goes up, or if your paperwork doesn't get submitted on time, you could be kicked off. This is especially tough for people with fluctuating income, like hourly workers, gig workers, or anyone in seasonal jobs. And then there's the home equity limit. Right now, Medicaid has a rule that if your home is worth too much, you might not qualify for long-term care support.
In this part, they're being slick. I know exactly what's happening here. They're saying that if your home is worth too much, so let's say your home is valued at $500,000. Why are you on benefits? Why are you on government benefits? This is going to force people to sell their homes for a fat discount. All these baby boomers that are sitting on $1 million mansions, they're cozy and comfortable, they're going to have to sell everything. The thing about baby boomers is this. They are completely delusional. They operate in a completely different reality that the rest of us don't operate on. And some of these people have mental issues that cause them to be hoarders. So they hoard things like money, wealth, houses. Meanwhile, it's just one person that lives in a whole mansion. But they're claiming government benefits? Don't you think that's stupid? Meanwhile, you, the caregiver, you're struggling. And everybody else is struggling. You don't think the lawmakers know this? Of course they know it. And they also know that there's no more money in the economy that is circulating in the economy. So this will mean on the forms, they're going to ask you, are you a homeowner? As soon as you say you're a homeowner, that's going to trigger a red flag that we need to check to see how much your house is worth. Mom's got a 3-4 bedroom house that is already paid off. That's probably worth like, $750,000. That house is going to be forced on the market for maybe $300,000 or even $150,000, depending on how the economy is going to go. When it comes to medical services, home care services specifically, people don't compromise on that. If it means that these people are going to have to sell their mansions so they can afford your services, they will do that. So this is more money into the market that is coming as a result of this bill. So we should look at it more from a positive angle and ditch trying to work with the Medicare and Medicaid and go straight private pay.
This bill tightens that rule even more. It raises the threshold states can use, but also gives them the option to use lower limits if they want. That could hit seniors hardest, especially those who own their homes but live on fixed incomes. The next part of the section deals with immigration and emergency Medicaid. It restricts Medicaid access to certain non-citizens, again reinforcing that eligibility is tied directly to lawful status. At the same time, it expands federal Medicaid support during emergencies.
I understand that there are people that are illegal that need these services. I totally get it. But think about it from the other angle too. There's a whole generation of Americans and even some people that worked hard to get to the level of becoming either citizens or residents. And that journey wasn't easy for them. It's only fair that those people that follow the rules get these benefits. It just makes sense. Let's not pretend to be offended here, because ultimately if somebody comes to my village that is not from my village or my country and starts getting benefits from our stuff, our resources over there in my village in Africa, I'll be offended by that. So you got to be empathetic to the American people too. That's my 2 cents on that.
Natural disasters or public health crises, so states can still provide short-term care in urgent situations. Now, moving into spending oversight, the bill places a pause on implementing staffing rules for long-term care facilities. That was a rule designed to make sure there were enough nurses and caregivers in nursing homes. By freezing it, facilities aren't required to hire more staff. even if residents need more care. This could reduce costs for nursing homes, but it might also reduce the quality of care for patients, especially seniors. States are also being pushed to reduce their Medicaid costs across the board. That includes limiting who can qualify, lowering reimbursement rates, and cutting back on services that go beyond the federal minimum. And here's one that's making headlines: banning federal payments to certain providers. This clause targets prohibited entities, which could include organizations that provide abortion services, depending on how states interpret the law. The exact impact is still unclear, but it opens the door to broader restrictions on where people can receive care, especially low-income women. The next set of rules go after financing strategies that states have used for years. Things like provider taxes or state-directed payments. Basically, creative ways states use federal matching funds are now facing new restrictions. Some states rely heavily on these mechanisms to keep their Medicaid budgets balanced, so tightening them could cause ripple effects on access and services. There's also a new requirement that Medicaid demonstration projects, these are state-level experiments with new care models, must now be budget neutral. That's not totally new, but the language here gives federal authorities more power to enforce it. So states won't be able to pilot new ideas unless they can prove up front that it won't cost more. And
Oof, this is brutal. I think we're going to end this video here and just wrap it up. So if you look at the top point there, it's like certain adults must now work or volunteer to keep Medicaid coverage. Yeah, people are going to be forced to work. You know, it's sad, but it's a reality. Everything is going to get privatized. This is a setup for privatization, the way I see it, because a lot of American businesses are struggling right now. There isn't enough opportunity, so this will enable even more opportunities that we are not even aware of yet. So there'll be new sort of jobs created. What will not be affected is the physical caregiver role. That will not be affected, because no matter what, when it comes to care, AI is not going to even replace you guys. So if you are the best caregiver there is out there, and you need to showcase how good your work is to the wealthy people. Wealthy people are the ones that have the money. You already saw the government does not have the money and is planning on cutting. The only type of clientele you should be going for are wealthy clients that pay you private pay, out of pocket. Those are the ones that you need to be focusing on. If you're ready to work with the best, which means that you're ready to articulate your value to these rich people and learn sales skills. I've created a sales training program that will allow for you to be able to convince a wealthy client over the phone first to do business with you. Let's say, for example, you're running Google advertising or you're running TV commercials and they see your ad and they call you, your company, your home care agency. You can convince them over the phone to do business with you. Schedule time. I'll put a link in the description of this video if you want to learn more about the sales training, but it will completely change your life. If you schedule time, I'll connect you to my top student. She's already done the sales training program before, and she's really good. I'll link the video that I shot with her so you guys can see how good she is. If you want to hire her, that's an option too. She will do a great job on close those deals for you. Schedule time. Talk to you soon.